what we actually try to do is to put things into perspective from, sometimes positive results, sometimes negative results from the recently performed phase 3 or phase 2 anti-amyloid immunotherapy. So we try to put those all together and see what this tells us about these drugs, about their efficacy, about their side effects. So we made a choice, which was only to select the drugs that were responsible for a high clearance of amyloid as measured with amyloid-PET, because we considered that it was a recent game changer in anti-amyloid immunotherapy since the PRIME study from Aducanumab. So we decided only to gather data from these drugs. Which means that we gathered data from Donanemab phase 2, Aducanumab phase 3, Gantenerumab phase 3, graduate 1 and 2, and of course Lecanemab phase 2 and 3. So we gathered all this data together, which was actually reasonable, since all these trials, besides the Gantenerumabs, were performed on 18 months. So we had a common outcome at 18 months, and the primary outcome was always measured with CDR-SB. So we had a similar primary outcome for all these trials, and the inclusion criteria were quite similar, which means early stages of Alzheimer's disease with MMSE over 20. It could depend from one study to another, sometimes it was 22, but anyway, it was early stage AD with at least an amyloid biomarker. So all these trials were actually very similar. So that's why we decided to do a meta-analysis on them. And what we could see is that it was actually very consistent across this trial, despite the fact that some were positive, some were negative. The mean effect on the CDR-SB was very consistent from one trial to another, moving from 0.2 to 0.45. And as a mean, we had a 0.3 effect on the CDR-SB, which was significant in our meta-analysis, but that was not the point, to show a statistical effect on this meta-analysis. So we had a very consistent effect on cognition with these drugs. And on the other hand, we, of course, have side effects, ARIA. And what we tried to see was if we could measure the frequency of a serious ARIA, because in our opinion, ARIA are of course a problem, but it can be most of the time easily handled just with dose suspension, and a patient recover, and that's fine, we can keep going. So it's of course, an ARIA is of course a problem, but usually it's not a problem for the patient as long as we deal with it correctly. What we were more concerned about were the serious ARIA that led to an hospitalization or death of a patient. So we tried to gather these results across the trial. And across all this trial, we could actually measure that it happens in about 0.8% of patients. So it was quite high to our opinion. About 1%, 0.8% of patients under these drugs will at some point go to the hospital because of these side effects. And if we give them to millions of people, that's of course a concern, because tens of thousands of people will end up with this kind of condition. So that's why we wanted to do this meta-analysis, to see if it was consistent across trials, the effect, the cognitive effect, and if we could better quantify the risk of this serious ARIA. And this, in our opinion, helps the physician to measure the risk-benefit ratio of this drug, which is a significant, statistically significant gain on cognition, but not very meaningful. 0.3, 0.4, 0.2 CDR-SB point is below the minimal clinically important differences. And besides, we have this 0.8% risk of serious ARIA. So we really need to balance that when we make this kind of decision. Of course, it's very good news for the field, for science, that we, with anti-amyloid immunotherapy, can have a treatment for Alzheimer's disease and can stop its progression. And the scientist in me is, of course, very happy, but the physician also says, okay, it's very good news and a breakthrough thing for the field, but it's not a miracle drug so far, and we should remain careful and find individuals who could be better responders, or find a new combination therapy, or develop new drugs with better safety profiles. Anyway, it may be a breakthrough thing, but we need to do better for a good drug for our patients.